everyone, welcome to my talk today to support new clinical nurse educators or practice development nurses. Many years ago I was a practice development nurse and I went on to become a lecturer practitioner, which was a joint appointment between university lecturing and working in an NHS trust as a clinical educator. And I have spent my career in nurse education. It's a wonderful career pathway, and well done if any of you have been recently appointed to these roles. And I hope that you find the talk today helpful. If you have any questions at all, do put them in the YouTube comments. So firstly, when we look at clinical education job titles, you may find that you are a clinical educator, but the job title isn't clinical nurse educator or practice development nurse. And that is because we do not have national standardisation for clinical nurse educator roles. And Sprinks's paper in 2015 called for support and more standardisation of the role. And there was evidence of 35 variations in clinical nurse educator job titles. In 2014, the first UK clinical nurse educator network was founded by Dr. Bill Whitehead and Liz Allibone, and this is a fantastic network for clinical nurse educators to join. And they surveyed clinical nurse educators, and from their members, there was 235 members. They found this variation between organisations in how clinical nurse educators work, the job descriptions and the career pathways. So it was very interesting to sort of read all of this when you look at job titles. And if you're interested, Ariel Lanada and I in 2021 completed a service improvement project, and that project aimed to reduce variations in clinical nurse educator job titles and the difference between job descriptions in a hospital division in an NHS trust. And we wrote job plans, job descriptions, and the career pathway was aligned to professional experience and academic courses. So it's an interesting paper to read. If you are interested in your own career pathway, I have a video on my YouTube channel, different nurse educator roles and how to become a nurse educator. So you might be thinking, I'm quite interested in becoming a university lecturer or becoming an education lead, for example. So there's lots of tips in that video, and that's free on my YouTube channel. So leading on from those papers, as I mentioned, we've got all these different job titles. So you might not be a clinical nurse educator or development nurse. It could be clinical educator, practice educator, facilitator may be your job title, or practice educator. And I differentiate that there's a clinical education role where you would be going into, you'd be part of working with nurses in a clinical setting, teaching, facilitating learning, supporting others, promoting evidence-based practice or quality standards. The roles can vary, they take many forms depending on the employer, but many would be looking at inductions, welcoming students, inductions for newly registered nurses, looking at support workers, and delivering orientation programs, study days. You might have your job description may be linked to serious events like never events and serious incidents, and it might be that the managers in the area, a key part of your role is to look at audits and look at learning from audits and sort of looking at quality standards and teaching packages linked to quality standards. As I said, it depends on the employer, but essentially you're in a clinical setting. And I would differentiate that between more of a corporate service training role, where you may be leading a program that goes across multiple areas across a whole service. So, for example, leading a preceptorship program or being part of a preceptorship program team, and or apprenticeships, or support worker, the care certificate, for example, or delivering clinical skills to newly registered nurses, or a leadership course. You'll have lots of different people coming to that program, and whereas you're not actually going out into the clinical settings providing teaching and support in a clinical area. And then you've got university joint appointments, such as the appointment I had was a lecturer practitioner many years ago, and As a clinical educator, you may also be an associate lecturer where you offer some part-time hours to deliver some teaching or to work with doing some skills or some simulated teaching, and you're paid for that separately. Or you may have a full-time lecturing role. That's another type of teaching role, or a lead clinical educator role across services. And then there's also freelance nurse training and private companies, or working for a charity. So as I said earlier, well done if you're newly appointed as a clinical nurse educator. It is the most wonderful role to have. I think clinical education has given me so much joy. I think the positive influence that you have in practice and the feedback you get when somebody is struggling, understanding, I don't know, an area of practice, and then suddenly the penny drops and they get it, and you get that positive feedback from learners. It's obviously got its challenges. It's very difficult balancing working, because often you have clinical shifts to work with, meeting the education components of your role and the standard setting, etc. But it is an amazing role, so well done. The roles are very competitive, so you've worked hard to get this role, and I really hope you enjoy your career in nurse education. So 4 ways to support your progression. So these are my 4 key tips, and I'll give you a bit more detail under each one. First thing, increase your insight of what the role entails right from the start. Establish a support network. Complete specialist training and academic courses aligned to the role, and then promote evidence-based practice and influence practice as you progress in the role. So looking at increasing your insights of what the role entails, the first thing I would suggest you do is network with people already in the role. What works for them? And it could be that there isn't anyone else on the ward area that you work, but there may be professional development forum or education forum groups that you can join, or other people in similar roles across your institution where you work. So look at networking with them. You can also look across other employers. As I mentioned earlier, we've got the network nationally with the Clinical Nurse Educator Network, and they have a website. They're on Facebook and Twitter. And if you throw out a question on the Twitter, for example, you will come back with some fantastic positive responses. And they also have conference days once or twice a year, and they're a fantastic group of people. It's a fantastic network to link to. Looking at setting clear goals and objectives with your manager. As I said already, that employers have different expectations. It depends on where you work, and it's important that you understand what is the expectation of my line manager, and working with the line manager so that you're very clear on what the expectation is. When you're looking at networking, either locally or nationally, the sort of tips I would say to be looking at is find out what templates they use. Some clinical nurse educators are responsible for holding information. They have to scope information. There may be helpful templates, administration. You might never have used an Excel template, for example, and everybody's at different levels with IT. So some clinical nurse educators are very happy, or I'd say most clinical nurse educators would be very happy to share their experiences and their templates. And they may have schedules for orientation programs. And although it's a different specialist area, it can be very helpful to look how they've formatted their orientation programs for all different types of learners. They may have teaching resources and aids. They might have questionnaires, induction packs, virtual online resources. Always acknowledge people's work. So if you do use a template, ask if you can use it and adapt it, and make sure you put the date and that it was adapted, and acknowledge the person who originally wrote that work, especially if it's come from another trust. And sometimes you do have to get authorization for that as well if it's from another trust, but usually people are very happy to share. The other thing you can look at is maybe identifying a clinical supervisor. So if it's somebody very experienced, you may want to ask them to provide sort of feedback later on your development, or just have somebody to talk to have a coffee, or have more of a formal clinical supervisor as well. And often clinical nurse educators are very happy to do that if they're experienced. Sometimes as a clinical nurse educator, I would put up visual boards. You might put up, I don't know, some posters in the patient waiting room or in a coffee room, and information boards, or I would have an education board where I'd put up if there was teaching opportunities or research opportunities, and looking at how people set boards up and how they communicate opportunities to their staff. That is something very good to look at as well. And then a third thing I would say is looking at service improvement, quality standards. How do they share quality standards? How do they look at influencing care, promoting compassionate care? And they may be involved with shared governance councils or service improvements projects, journal clubs, and just looking at how they set those up and gaining those insights is very helpful. A core thing that you need to be aware of is that in your role, you're a role model, and people will be asking you for the latest evidence or for advice on careers. So it's important that you keep up to date with any changes in your profession. And obviously, if you don't know and you're new, you're not expected to know, but you would know who to go to in your trust, for example, if a support worker wanted to know about apprenticeships. So creating a contacts list of people that you know you could go to for support. It might be clinical governance, safeguarding, it could be your specialist nurses or advanced nurse practitioners, for example, but creating a contact list and of resources that you can link to evidence-based practice. And you've also got national resources. If you are interested, on my YouTube channel, Support and Career Development for Nurses, I have lots of videos. So some of the videos that you might find helpful in your role, if you have support workers coming to you asking about apprenticeships and the different routes into nursing, they may want to self-fund and become a registered nurse as quickly as possible on a pre-registration 3-year degree, for example, or do an apprenticeship, become a nursing associate, and then top up to do the registered nurse degree apprenticeship. And my video on how to become a nurse and different routes is helpful. In England, we have the nursing associate role, and I'm aware that role is not spread out across the 4 nations. Nursing associates are only registered with the NMC in England, but if you are a clinical nurse educator in England, you need to know the difference academically between a support worker, nursing associate and registered nurse. Looking at preceptorship for nurses, the 4 nations have slightly different guidelines. In Scotland, for example, you've got Flying Start, which is like an online structured programme. In England, we had Health Education England have recently written new guidance, up-to-date guidance on preceptorship, and there are minimum standards, core standards, and gold standards for preceptorship, and they're looking at accrediting employers that meet the criteria for preceptorship, the standard for preceptorship across England. But it's a good talk to look at regarding preceptorship. Clinical supervision is another one, and the different types of clinical supervision. We also get staff that don't always manage to access funding, because we know funding is restricted. It's not there for everybody. Not everybody can access a course every time, and staff might have to look at alternative means. So looking at other funding streams that might be external, charitable, national institutions. So there's lots of guidance in that video. Delegating nursing care, which is something that newly registered nurses worry about, and the 4 pillars of advanced nursing, and looking at research roles, and there's lots of videos on there looking at different career pathways. So we now have so many opportunities for research and early career studentships, fellowships, different research awards nationally that people can apply for. So those videos are quite good as well to have a look at if you're interested. The second tip I've got is to establish a support network, and that would be for any nurse in any role, but finding a mentor early on to offer direction. So you'll have your line manager. Do you want to have another clinical nurse educator, or there may be somebody from university, a university tutor that you still network with, but you do need somebody in the area that's going to feed back on your progress, and that is usually your line manager. And finding a clinical supervisor to reflect on key issues is important. And I would say the key tip really is to book meetings in advance through your first year as a new clinical nurse educator or practice development nurse. Completing specialist training and academic courses aligned to your role is going to give you so many more skills. I remember when I first started, and I started with the postgraduate certificate in education, and I never in a million years thought I would be lecturing students, but I kept carrying on with my education, and I did a postgraduate diploma in education where I had to do some lectures, and it just developed and snowballed. When I became a lecturer practitioner, I had to start preparing lectures, and lecturing isn't for everybody. But what I would say is doing those courses in either my clinical nurse educator role or as a lecturer helped develop my skills, my confidence. So I would highly recommend doing an education course if you haven't done one already. Specialist skills, you might need specialist skills because you're doing simulation or you work in a specialist area. Often clinical nurse educators, so for example, if we had a clinical nurse educator in neurosciences, one of the requirements of the role would be to have a specialist course in neurosciences. But I know not all clinical nurse educators work in specifically specialist areas, but some areas will have that as a requirement. And as I mentioned earlier about looking at career pathways, finding a career advisor if you're unsure. I am always happy to do meetings on Teams or on Zoom to talk through what it's like to be, and I might even do a talk actually on the difference between sort of being a university lecturer to a clinical nurse educator. But I'm always really happy to talk through the pros and cons, but finding a career advisor, because also you may not want to stay as a clinical nurse educator. You might gain those skills, lots of skills, transferable skills, but you may want to use those skills to become an advanced nurse practitioner or an education lead or a researcher. You've got lots of opportunities in nursing nowadays, and having a career advisor is helpful. So when you're looking at educational career pathway, in my book, How to Prepare for Interviews and Develop Your Career, I have got different template career pathways, one for advanced nurse practitioner, one for research, one for education, and one for clinical leadership. If you look at the clinical education one, you'll see starting out in your career, you might be a staff nurse interested in education, and down the middle of the table, you'll see the professional development and experience, and on the right, the ideal academic courses as you progress. So when you're first starting out, you just need a BSc or a master's in pre-registration nursing. And then an interest in education, you might become a link nurse in an area as a newly registered nurse, for example, an early career nurse. When you're looking for for a clinical nurse educator role, it might be a band 6 role, for example. Usually you're expected to have 1 to 2 years experience. I'm aware that across employers it might be different with different titles, but this is just general examples. But you should be supervising others in practice and a proactive interest demonstrated in education. So linking with other clinical educators or with the line manager, looking at teaching, supporting different levels of staff, maybe linking in with quality improvement projects or training programs. And an ideal course to do would be your postgraduate certificate in education. When you're looking more at a band 7 role, it could be called a practice development lead. I know that some practice development nurses are set at band 7, but if you're looking at more of a senior education role, you usually require experience of 2 to 3 years. Previously worked as a band 6, not necessarily as an educator. So there are people that become deputy team leaders that move over into education. But you should have some prior experience supervising others and leading or project management demonstrated, where you might have led some teaching programs or developed some teaching resources as a project. And your ideal courses would be a postgraduate certificate in education, but ideally a postgraduate diploma in education would very much help you in that role, and we're either having a master's or starting to work towards a master's. And then for university lecturer or lecturer practitioner level, or a more senior corporate education lead, it would be as above. More experience, you might already have had experiences at band 7 level or an 8A level, and then a master's in healthcare leadership, education or management. So hopefully that's given you a bit of an idea of some career pathways and how to align your professional experience and development with academic courses, because it will help your career progression. Another key aspect of your role is to promote evidence-based practice and quality standards and influence practice. And you might do that through running a journal club, leading a quality improvement or research project, or publishing your work. And when you first start out, you might think, oh, I absolutely wouldn't have the confidence to do that. But there's nothing wrong with that. You just might want to join the quality improvement lead and observe what's going on, and eventually start to link in with groups, and locally or nationally. Contributing to policy development at local or national level, attending professional forums and shared governance groups, and acting as a link between university and practice, attending conferences, programs and annual reviews. Don't be too hard on yourself. Don't think you should know everything. If you don't understand something, you're not quite sure, just be honest with staff and then just say that you'll try and find out. If you're interested, I have some videos on how to influence nursing practice different ways, looking at research in nursing and quality improvement and service improvement projects for nurses, and the 4 pillars of advanced practice as well, all linked to evidence-based practice and influencing practice. So I hope you found the talk helpful. That's the 2 references if you're interested in the paper. If you have any questions at all, do pop them in the YouTube comments. Give me a thumbs up if you found this helpful on YouTube. And if you'd rather contact me, DM me on Twitter or on my website, because I know YouTube's more of a public forum, I'm very happy to answer any questions, or to arrange to meet up for any career advice as well if you're an educator. And good luck with your future career.